Detroit's neighborhood service organization is working to change the conversation about homelessness in the city. The nonprofit and its community and government partners are planning a sustainable campus that's going to offer life-changing support services. One Detroit's Will Glover has the story.
In the McDougal-Hunt neighborhood on Detroit's east side, the neighborhood service organization broke ground on the Clay Center, a campus to end homelessness.
What this campus is intended to do is help uplift them and giving them the tools, life skills, and support that they need so that they can pull themselves out of the situation.
The Clay Center would be the first campus in Detroit to have a temporary shelter, provide homeless single adults with access to permanent housing, a medical residence, and fully integrated healthcare clinic.
In 2014, when the economy was better, we had 3,000 homeless. And I said, what are we doing if we're spending the same amount of money and the homeless count doesn't go down?
The Clay Center has been in the works since 2006, but the estimated $20 million plus facility hit a snag when the Illage-owned Olympia Development backed out of a verbal agreement to purchase the NSO's previous headquarters.
That definitely was a concern, but for me, I really couldn't get too much involved because that was a private decision that was made between two entities. My main focus, again, is making sure that we are serving the population that is most vulnerable, and that is our homeless population.
After another developer, MHT Housing Inc., stepped in to partner with the NSO, the project moved forward. Also joining the effort to provide affordable housing for 45 adults on the 3-acre campus was the Michigan State Housing Development Authority.
They pay 30% of whatever their income is, and the rental assistance will help to provide the rest. Their income can grow over time, and then the amount of rental assistance that will be paid would decrease along with that over time.
As the NSO continues to raise finances, phase 1 of the project for single adult housing is expected to be finished by 2020, with the 56-bed temporary shelter and medical clinic to come at a later date.
No one chooses to just want to be homeless. We are providing all of the wraparound services to help them transition from homelessness to fully living and thriving in the community.
Joining me now is the president of NSO, Linda Little, along with David Tinsley, a former NSO consumer who now works for the organization, and Chad Benson from the Michigan State Housing Development Authority. Welcome all of you to American Black Journal.
Thank you, Stephen.
Yeah, so Linda, let's talk about what you are building over there on the east side. That's not too far from where I grew up. I know exactly where that is. But talk about what you hope to do with this campus.
So what we are going to do at the new campus to end homelessness is what we're calling it. We're going out and actually saying it. That is our goal. For those that we touch, we want to end homelessness for them once and for all. We do a lot of work in the community with the homeless population today, as you know, through the Tamani Center, our street medicine program. We have permanent supportive housing on Oakman Boulevard, one of the largest permanent supportive housing units in the state, actually. And we also have scattered site housing. This is unique because it's a campus that has all of the services in one setting.
In one spot.
In one spot,
Yeah.
That's correct, including integrated healthcare services. Wraparound supportive services. So when they are in our catchment, looking for us to support and guide them through this process, we will have every tool at our disposal to help them through this transition.
Yeah. One of the things I know is key with trying to help the homeless population is getting them to engage with organizations like yours. How are we going to get people to come to this campus for the help that they need?
Well, you know, a good thing is in Detroit we have a system which is called a continuum of care that has access points for people to engage in support services to get housing. So actually we have, within one of our sites, we have an access point there. In this new project, an access point will be there.
Yeah.
And so that through that access point, people get, you know, there's an assessment that is performed to determine what type of housing they may qualify for and what type of support they need.
Yeah. David, you were a consumer at NSO, which I really want to hear about that experience. What brought you to NSO?
In 2008, I was released from prison into a program sponsored by NSO called the Prisoner Reentry Program. I was paired with a dynamic therapist for substance abuse services. And I was so excited about what he was doing, I picked his brain for everything that I could to find out how he got his job and what I needed to do the same thing.
Yeah, yeah.
And so from that point, I had ended up doing some other work, removing asbestos from schools and getting away from what I really wanted to do. But when that door closed, I came back and asked for a job at NSO. And I got the job, and Mr. Lewis Hickson, who was the operations manager at the Tamani Center, just said someone had to help you. So with that and deciding I wanted to finish college, get my associate's degree, I ended up going to Wayne State for my bachelor's degree, ended up going back to Wayne State for my master's degree.
Wow.
In the process, I'm on my 5th job with NSO.
And so now, I mean, you're helping some of the same people, or people who are in the same situation in many cases that you were in.
Well, I began at the Tamani Center. So I began at the ground level. From Tamani Center, I took another job as a PATH case manager. So I went into outreach and I found the people in shelters, under viaducts, in places not meant for human habitation.
Wow.
Put their cases together, identification, all the documents, eligibility documents that are necessary to enter into a program. From that job, the man who hired me retired, and then I got that job as operations manager.
Wow.
But I wasn't done because I wanted to be a clinician, so I went back to school, took another job as supportive housing case manager. When I graduated, I ended up being a supportive housing supervisor.
Wow. Wow.
5th job.
Yeah. When we talk about homelessness in the city and even statewide, give us an idea of how pernicious a problem it really is.
It's definitely a problem, and it's definitely something that we, as an agency, recognize, and that's why we focus a lot of resources towards these types of, what we call permanent supportive housing developments. Because we see the value in sort of combining the resources that we have to be able to make housing affordable for people that can't otherwise afford it, with groups like Neighborhood Service Organization that has the connection points to be able to provide those services that really can leverage a lot of really good benefits, like David said, that otherwise it'd be very difficult to do.
Yeah.
So yeah.
This is named the Clay Center, and that's got to be for Sheila Clay, a friend of mine who ran NSO for lots of years. I really, I remember when she came here to talk about opening the facility on Oakman, about the kind of hope that she had for it changing. I can imagine that this is just another big step forward in the things that she already started.
She did, and this actually started under her leadership about 10 years ago. And it pulled together, really champions that have helped to make this day possible for us to sit here and talk about this new campus. So we are very grateful for all the support that we've had from the vision that was provided by Sheila Clay, Mayor Mike Duggan, who supported the event, and of course MSHDA, who have really stood behind our mission to help serve this vulnerable population. And it's proven to work through our project at the Bell Building. Once they get housed through the Housing First model that we use under HUD, it's our job to then provide those supportive services to help the condition, because what we see, housing instability is the climax of a greater social crisis. And so
it's not the first thing that happens to you. It's the result of the things that happen.
It's a result of a culmination of, or a series of, or a lifetime of, we can keep going on. And David is an example of how, when you provide the supportive services to people, sometimes it takes time to engage them, as you said. But once they get they agree and accept, and they make the choice to change their lives, we're going to be there to help support them.
David, talk about the difference between your life before NSO and now, the things that are making a difference for you.
Well, before NSO, I couldn't get a job. But NSO, everyone turned me down. I felt a certain way about that, but I came to realize that I'm where I'm supposed to be. Everything I've gotten thus far in my career, I don't have a job, I have a career, has been based on what an NSO
Because
has done
of
for
NSO.
me. Yes.
Yeah.
They didn't give up on me. And so as they haven't given up on me, I don't give up on clients.
Right.
That's right.
Right.
And one of the things that David and I talk about with this new campus is he had a journey of series of rejections and situations, and it was always somebody who chose to help support him in one way or another. What we're trying to do is create a village, so it doesn't take a lifetime of onesies, twosies of people trying to say, I will stand up and help you after being rejected by a series of people.
Right.
We want to create an environment so that they can come to one place and get the support they
You know,
need.
one of the other things that I always think is important in the conversation about homelessness is I think we tend to think of it as a kind of a permanent state, that you're either someone who lives in a home or you're someone who's homeless, but that sort of transience back and forth is one of the things that makes it so pernicious. And it seems to me that what you're doing on this new campus is trying to interrupt that cycle, right? It is a cycle sort of for a lot of people in and out of that state.
Yeah, and you're right, Stephen. The face of homelessness has definitely changed, right? What we see today is not what we saw, and I think Mayor Duggan made some mention of that even from 2014.
Yeah.
We see a lot of families
Kids.
with children.
Yeah.
There's a lot of children who go to school every day and come home to what we call home. Their home looks very different. There are a lot of people who come to work and then go to a place on the streets or under a viaduct. And so we have to be, what NSO has done throughout our almost 65 years of serving this community is evolving with the changing demands of our community stakeholders to meet those needs. And so that's what this new campus is designed to do.
Yeah. The state's role in all of this is really important. Talk some about why the state, I guess, is there playing that role.
Yeah, well, so the resources that were used to help finance this development, the low-income housing tax credit program is a resource that's it's irreplaceable.
Yeah.
You can't go out in the market and just find that type of a resource that brings that much to the table to be able to help these developments get done, and especially get done right, where you have a situation where people that may not have very much income at all can be able to live there and be able to grow and thrive with the services that they need. So it's a really critical role that we believe that we need to play.
And I feel like it's a role that not everybody knows the state is actually playing. It's a helpful role that the state is playing.
It is, definitely, yeah.
Tremendously help. Without them, we couldn't
It wouldn't
do this
work, right?
It wouldn't
The financing
work.
wouldn't,
It just wouldn't work.
wouldn't come together.
No. And donors, foundations. So we're appealing to everyone now to help with this phase 2 of this project, because we are in the midst of a capital campaign to raise about $6 million for construction costs. We want to do this debt-free because it's a sustainable campus.
Makes it more sustainable, right?
It's sustainable, all of our programming, our billable services, and so it operationally will sustain itself, but we've got to get it there.
But you got to build it. Yeah.
Yes.
Okay. Well, good luck with the campaign, and
Thank you,
congratulations on the idea.
Thank you.
Thanks for being
very
here.
much.
Thank you.
Thanks for having us.
All right.